So I have been through body contouring and facial plastic surgeries myself. I had several operations in 2013. Um, I will attest that the results are dramatic. I went from a size 24W before my bariatric surgery, and that was in 2003, to a size 14 after weight loss. And after my plastic surgeries, um, I wear a size 2 jeans now, and thanks to my facial plastics, thank you, and I would say thanks to my facial plastic surgeon, I look about 15 years younger. So while some of my procedures were cosmetic, I would argue that it was primarily a reconstructive plastic surgery based upon my earlier comments about my deformities. After all, the medical definition of reconstructive is to restore function or normal appearance by remaking defective organs or parts. For example, it was difficult for me to exercise. I could just, like, if I ran up the stairs to go to the second floor of my house, my apron, my belly apron would just flap up and down against me. I mean, I could hear it. And after my tummy tuck, I went and I became a jogger, a runner. So um, it helps quality of life as well as physically helping to improve your health in that regard. But sadly, with some exceptions, few health plans, as we were discussing before, will cover the cost of these surgeries. And even though obesity has now been classified, a disease, it often takes long for industry to respond to that. And I know you said that they are. You have been successful in your practice in getting some of these surgeries covered, and some of them, regardless, are still considered cosmetic. But what would you say? How often do you see that patients are successful in proving medical necessity for reconstructive plastic surgery after weight loss? And have we made any progress in insurance coverage across the years?
Well, I definitely think that there has been progress, and I think one of the main reasons, as you mentioned, is the fact that obesity has been covered. Um, the lap band and the gastric bypass has been covered because, and even by Medicare because it's considered a disease now. But still, the plastic surgery part of it mostly has not been covered, and one of the reasons is, again, probably logistically, is the fact that before a lot of the insurance companies were just having general practitioners look over these patients' charts who were, being, having their records submitted for coverage. Now there are plastic surgeons that are looking at these particular procedures to see if they're covered, and they tend to be much more circumspect as far as what is and what isn't covered. Okay, but again, in my experience, it's a very personalized thing as far as what's going to be covered and by whom it's going to be covered. There's a lot of variables
Mm-hmm.
involved. Okay, you're talking about, first of all, what insurance carrier is it? Okay, you're talking about what state is it in, and more importantly, what part of the body is going to be covered. I mean, whether the person has a functional problem. Let's say, do they have a rubbing of their tissue? Okay, in other words, when you have, as you mentioned, when you have your tummy rubbing against the pubic area, even when there's hair there, okay, you're going to end up with a dermatological type of a problem. So a lot of these companies will say, well, okay, if you've had documented dermatological problems for 6 months, then we'll cover that particular procedure. Uh, also, some patients have problems having their, or no, I'm sorry, that some patients have good luck covering their inner thigh procedures, their thigh-plasties, because they have difficulty walking or running, as you mentioned, because basically you're rubbing, against that particular area there. Other procedures like the facelift, because of excess skin there, or even the arms, the brachioplasties are going to be much more difficult to be covered because the insurance companies still consider them to be cosmetic. Uh, and as a sidelight, most of these insurance carriers we found need to have a pre-authorization. What that means is that uh, we see the patient either in person or Skype or FaceTime, and if they're in the area or out of the area, we do take pictures and we go ahead and submit it to the insurance carrier. Okay, and that process in most cases tends to be long, and the reason is because the insurance carriers are trying not to cover these procedures. I mean, obviously, it's financially to their benefit not to cover them. So uh, it may take months, okay, 6 months, even to a year. Okay, if the person is persistent, and we try to be an advocate on the patient's, part, okay, to try to get it covered, and they're willing to wait. A lot of times, they will, get them covered, or at least, some of those things, as we mentioned, the tummy tuck part, or the inner thigh part. Uh, a lot of times patients just get, they just want to be finished with the whole procedure, and they go forward and just go ahead and pay for the procedure. We do have financing plans available which help the patient in that particular case. If they get denied coverage, okay, we then can go ahead and appeal, okay, to the insurance carrier once again. But again, that's another process. That's going to take much, much longer to do, okay, with either a positive or negative result, as I mentioned, depending on all those different variables. So it really depends on, again, the individual, the procedure we're doing, as well as the insurance company.
Well, I would really encourage patients to work with a plastic surgeon who not only has experience, a deep experience with bariatric plastic surgery, but also with one whose practice is going to advocate for them with the insurance companies, because fighting an insurance, getting a pre-auth, or fighting an insurance appeal is not an easy process. It's not something that we as patients go through often. It certainly is an aggravating process. And if you have a plastic surgeon's office that is willing to do that, then it's going to open up the opportunity for so many more people to be able to afford plastic surgery. It's not cheap. I was self-pay because the plastic surgeon that I used did not accept insurance, but I was very fortunate that I had saved the money up, and I made it a priority in my life. I am not a wealthy person. After I had my gastric bypass, I just saved a little every month and put it into my plastic surgery fund. It was a separate bank account. My surgeries were $40,000. That was for my entire face and my body, and so I had 7 procedures on my face, and I guess 5 procedures on my body. I had everything basically done on my body except for breast implants. Um, while prices vary by region, can you give a price range for a lower body lift, which is a real common procedure that massive weight loss patients have? And it's an extremely effective post massive weight loss plastic surgery because it addresses the abdomen, the mons pubis, and the outer thighs and buttocks. So it really does cover a lot. And that surgery in and of itself is quite affordable. It's quite a low sticker price for what you're getting.
Right, and again, Cheryl, we have to, it's great to start quoting prices, but the thing is that you got to quote apples to apples. So, basically, again, it could be, different things as you just mentioned. I mean, lower body lift can be, something from just a paniculectomy, or basically it could be, you know, a full abdominoplasty with a diastasis recti repair, okay, with a pubic lift, okay, with liposuction, with buttocks implant, or putting the tissue in there, as we mentioned, either autologous or fat transfer with liposuction. So again, it really, it can, and also whether it could be as an outpatient or as an inpatient, okay, donating some units of blood, not donating it, how long the individual doctor takes with the procedure.
Hmm.
So there's very, very variables. But I would say if I wanted to get a very, very broad range, I would probably say you're talking about anywhere maybe from $8,000 to $20,000.
Hmm. Hmm. Kind of like buying a car, right? Depending on what options you put on.
Exactly, exactly.